equipment which I really love at the office. It is called the CBCT. It is a scanner which is a CT scan, really. What it does is that it's mainly for the head and the neck, but we focus it on a specific area of the mouth. We generally just take all the teeth, and we can see a lot more than an X-ray can see in a three-dimensional view. So I can kind of move, let's say a tooth, we're concerned about a certain tooth. In a regular X-ray, it's two-dimensional. You can't see many things that get superimposed on each other, but with a CT scan, you can kind of move it around in space, and you can see that tooth in many different views and from many different aspects. And let's say there is a fracture somewhere on a root that you would never see within a regular X-ray. You can easily pinpoint in CBCT in a CT scan, and it's quickly becoming a very important tool in dentistry, and it's really an exciting piece of equipment because it makes treatment planning a lot easier, and it helps diagnosing a lot of issues that don't come up otherwise. And when it comes to surgical procedures such as like placing an implant, it will really determine a lot for us, the landmarks where, let's say we're placing an implant on upper arch, upper jaw. I can tell, how much room there is until we get into the sinus. How, thick is the bone? What is the quality of the bone? Is it, what kind of implant can I place? And then from there, I can use the same program, the same imaging to plan that out. So how do I want the tooth to look? Okay, well, I want the tooth to look aesthetically in this area in the mouth. So how do, it will plan the implant in a way that, will optimize how well the implant is placed, how, the biggest implant, the widest implant that works in that area. But at the same time makes the aesthetics of the final work, the function of that final crown, a lot easier to determine because it's all kind of laid out for us, like right in front of us. So it's really one equipment that I love absolutely like to use, and it's quickly becoming sometimes even a replacement for X-rays. One scan can tell me so much more than 20 X-rays can tell me at any moment. So it's I can move things and see it in sections. I can see, let's say this is a tooth, and on an X-ray all I see is like from the front. I see, okay, well, there are 2 roots in this, but really they're not. There are really 3 roots in this, so you can see that really well. Then somebody had a root canal done and there was an extra, let's say, most people know there's 3, most dentists know there's 3, but sometimes there's 4 and 5, and they could get missed. And what you do is with the scan, you can kind of do sections of it, and you will see as if like you're cutting through here, and can tell, like, let's say, oh, there is a canal missing right there, or there's a fracture there, that we didn't see before, or there is a small infection starting at the tip of this root that we didn't notice in a regular X-ray. So it gives us like a lot of good information. So it's one that I really enjoy using. No. It's not a common equipment. It's very expensive. It's like over 100,000. So it's it's pretty expensive. But it's like between 100 to 200, I think, to get a new one. But it's really just the amount of information you can get from it is not comparable to anything else.